Now I'm honored to introduce our keynote speaker, Dr. Komal Bajaj. Dr. Bajaj is a transformative healthcare leader who is a catalyzing agent across the areas of healthcare industry. Her work sits at the intersection of quality, innovation, and environmental sustainability. Dr. Bajaj serves as the Chief Quality Officer at the New York City Health Hospitals at Jacobi and North Central Bronx, and the Medical Director for Sustainability at the New York City Health Hospitals. She also serves as an advisor for various public and private entities, including the AHRQ, where she was appointed by the Secretary of Health and Human Services in the National Advisory Council in 2022. In addition to her leadership roles, Dr. Bajaj is a professor of OBGYN at Albert Einstein College of Medicine and was recently named one of the Becker's Hospital Review top patient safety experts in 2024. She was also an inaugural National Academy of Medicine Diagnostic Excellence Scholar. Dr. Bajaj's work is regularly featured in prestigious media outlets, including the New York Times, NPR, Modern Healthcare, Becker's Hospital Review, New England Journal of Medicine, JAMA Health Forum. She's also a fellow in the New York Academy of Medicine. Komal will discuss innovative ways to promote staff engagement in quality and safety initiatives. Please join me in welcoming Dr. Bajaj.
Thanks so much, Dr. Naqshbandi. I realized how many buzzwords I have in my bio. I'm going to work to change that. Dr. Winston, Dr. Naqshbandi, and the rest of the organizing team, thanks so much for having me here. As I reflect on the many interactions that I've had with Downstate, it's just so nice to be with friends. I was also on my way here reflecting on the millions of things that had to go right for all of us to be sitting in this room today, and just sort of want to acknowledge the fact that we're taking a moment to reflect on safety and how we can all be better. And that panel earlier was just a beautiful sort of reminder of some of the various sort of opportunities we have to improve safety. So when Rami and I were sort of going back and forth on what to talk about, because there's so much, right, that needs to be done in safety, we were really thinking about, well, how do we honor our culture and our staff and the tremendous work we do every day? And so it's actually very fitting that today I'm going to be talking about the success cause analysis, especially after what we heard at the panel today. So as Rami mentioned, all my sort of disclosures and relationships are mitigated. I also want to give thanks. Some of what I'm going to be talking about today, it takes a whole village. It takes a whole village to do anything that we do. And so I want to acknowledge some of the individuals who have helped support this presentation. So what are our objectives for today? To talk a little bit about the value of a success cause analysis. I'm going to tell you what that is. Describe sort of how we might approach doing a success cause analysis, and then provoke each of you to think about how you might incorporate success cause analysis into the various ways that each of you sort of are involved with the organization. So I certainly, as I mentioned, driving here today, I was like, I'm going to go see my Downstate fam. I hold of all of you that you are intelligent and capable, want to do your best and improve, and I ask that you hold that of me. Is that cool? Yes? All right, thank you so much. I also want to acknowledge that in order for us to, in order to solve the problems in healthcare, many of which were outlined today, it's going to take all of us, each and everyone's perspective. Every single person in this room is valuable and helps contribute to the tapestry that is healthcare. So let's go to talk about healthcare, right? Healthcare is often described as a complex adaptive system. We've heard that word before, right? It's like a coral reef where there are all these wonderful things that are happening, right? The phlebotomy fish and the transportation fish has to work with the sort of the nursing fish to make sure that the patient gets to the radiology reef, right? There's so many things that are happening every minute in healthcare. And so as we think about, well, how do we get better, right? How do we do better in healthcare? It's important to honor that what we're working in is very complex and very adaptive. And it's been recognized that how we approach quality and safety, especially event analysis in safety so far, is limited. This article was shared by, to me by Dr. Benson. Actually, we were in DC last week. And it's from the Academic Emergency Medicine, which talks about some of the problems with how we view medical error. And the point really is that we oversimplify often the complexities of what are deeply interconnected processes. So I mentioned the word success cause analysis, and you're like, man, I don't know about that, right? Let's think about, in this campus right now, there are amazing things that are happening, right? Awe-inspiring, right? Rami mentioned that where we're that Downstate is the only transplant center in Brooklyn. Like, we put different people's organs in different people's bodies, right? We make a jaw out of a bone, right? And so all of those things are happening each and every day, right? The ER was mentioned numerous times, right? I'm an OBGYN, my clinical background. Every time I go to our ERs, I'm inspired by the work that happens. Because as was mentioned, people are often being cared for their medical problems and also the woes that ail them outside of the walls, right? And also, what about that diagnosis, right? That rare diagnosis when someone pulls together, or a team of people usually pull together all of those pieces and say, you know what? This is what ails you, right? What happens? Oftentimes people will high-five each other. Sometimes they may say, phew, we're so glad that that went well, right? Sometimes you might wonder, wow, that went great. Wonder why it went so great, right? All of the time, there are things that are happening in healthcare. So what is a success cause analysis? It takes root cause methodology, RCA methodology, to understand the factors that contribute to a favorable outcome. Now, some of you may say, it's like what Eric said, right? People have gone to root cause analyses decades ago and, oh my gosh, right? Like, not for me, right? Or maybe your job function means that you don't go to root cause analyses very often. In this talk, there's something for everyone, regardless of what kind of role you have. This also acknowledges that oftentimes, because of limited bandwidth, because of our culture, because of history and just how we've done things, we focus on the few percentage of events where things don't go well, where the outcome was unfavorable. But how can we learn from those things that go well? Eric mentioned, 9 out of 10 times the behavioral health response team worked perfectly, but that one time it didn't, right? That one time it didn't. My curiosity is, why did it go well 9 out of 10? Right? And what can we learn from that? And so a group of healthcare leaders, including myself, were asked in a commentary in the New England Journal to talk about, well, how can we sort of rethink and reinvest in patient safety? And so one of the things I mentioned was, well, how do we learn from all the things that happen, right? How do we learn from lots of things that happen? This is in line with our published frameworks for safe and reliable care, which recognize that leadership, culture, and how we learn, right, are crucial to sustaining improvement. It also is in line with what we all strive to move from a reactive culture, right, which is, I fully honor, is very hard, right, when you're dealing with so many competing priorities, to move to something more systematic, and wow, right, if we could be proactive. Health and Hospitals, Jacobi NCB is not there yet, right? But what we're going to talk about today is sort of edging us towards where we want to be. So when I talk, we have, even pre-COVID, we started doing success cause analyses because someone said once, wow, that thing went so well. I wonder why it went well. And it actually turned out there were some very specific reasons as to why it went well that then we could hardwire for the future. And so we've been doing success cause analyses in a variety of different forums. We stopped during the first surge of COVID, but we've been doing them across different sites at health and hospitals. And here are some of the things that we found. The first is that it involves engaging employees in the analysis process, right? Who doesn't want to talk about the amazing stuff they did, right? The clerk who told Dr. Scott, hey, go look at that patient, right? I hope that clerk talked about it, right? Everyone wants to talk about the things that they do. It also gives an increased sense of ownership and commitment. What we've also found is that it allows employees to learn from what has worked well. Like most organizations, Health and Hospitals does not allow those that were involved in an adverse outcome to be at the event analysis. It's a medical legal thing. But that rule doesn't apply for success cause analyses. So the people that were there can talk about what happened. It also allows for enhanced communication, right? We just talked about how culture is built outside of crisis, right? When you start to be able to have conversations about that other 95% of care, you're building culture for the times that it matters the most, right? When we are in crisis. It also allows for strengthening culture, just culture. I hear that it is Downstate's survey time for culture of safety. Please take your survey, right? Plug, free plug, right? Take your survey. It's also an opportunity to reward and recognize the hard work that people do each and every day, right? It goes from a high five or maybe an acknowledgement at a business meeting to something structural, something that then we can learn from and hardwire. So we wrote a little bit about some of our early successes with success cause analysis, or our early experience through an IHI blog, and actually Becker's recently picked it up. And I'll tell you, we've had engagement with health systems across the world, just recognizing that we do these things anyway, right? We do event analysis anyway. How can we broaden the aperture to really change culture and practice? So here are the steps of an event analysis. Again, if you've never attended a quote-unquote root cause analysis, it's totally okay. Just a reminder that you have to pick the events, think about who's gonna be there and schedule it, figure out the facts of the case, right? And oftentimes that requires talking to lots of different people, or it should require talking to lots of different people. Really think about what happened and sort of what caused it, the root causes, and then how are you going to take those learnings and spread them and measure them to know that change has actually happened. And so what I want to just sort of acknowledge is that we have all the tools to do a success cause analysis because we know how to do event analysis. But rather what we're doing than looking for root causes and problems or failures, those holes in the Swiss cheese, what we're trying to do is, what were the factors that led to success using the same exact methods? And I'll tell you, our risk managers across the system are really bought into this because they have all the tools, right? They have all the tools. So let's begin with a case, okay? So a patient experienced a rare and life-threatening anesthetic emergency known as malignant hyperthermia, right? If I mention the word malignant hyperthermia, half the room is like, right? Because it's rare, it's really life-threatening, and you need to move fast. So this happened in an outpatient clinic that happened to be on a hospital campus. Sounds familiar, right? A lot of places in New York, they're inpatient, outpatient environments very close to each other, right? The team was able to recognize what was happening, escalated accordingly, administered the special medications, and got the patient to where they needed to be. And the patient had a swift recovery and was discharged a few days later, right? In normal practice, it would have been like, gosh, you all are amazing, high five, that was great, excellent, next patient, right? Next patient, next care. So when we think about event analysis, right, you want to think about events that might have lessons for broader implementation, right? So here's a rare emergency in an uncommon area that has the feelings of something that might be interesting for other outpatient areas, like high-risk rare events. Also, we've used it for non-clinical events. So as Rami mentioned, I'm the Chief Quality Officer over 2 hospitals. We actually had to merge the QAPI program, or the Quality and Safety Activities, for 2 hospitals. And it went well. And so we were like, oh, well, why did that go well? Right? It could have been dumb luck, but maybe there were things there that helped promote that success. And so in relation to this case, right, malignant hyperthermia, though it is uncommon, was deemed to be of major significance and worth exploring. So let's go to the next thing, the timing of a success cause analysis, or the meeting, right? People say, well, we already don't have time, Komal. What are you talking about? And I'm like, I agree. You don't have time. I don't have time. We don't have time, right? So are there existing meetings and spaces that you could take one a year, one success cause in a year, and I promise you it will change your culture and practice. Involve those who were involved in the case, if possible, and invite other areas where lessons might spread. One of the biggest interesting advantages of a success cause analysis is where we invite a lot of trainees, so not just physician trainees, but respiratory therapists, ER, and other kinds of trainees, and people love learning, right? And it's something that sort of, wow, this is an organization that does stuff like this, and I want to work here, right? So similar to the RCAs, the hospital's risk manager facilitated the SCA and sort of did all of the background work that would typically be done during the event analysis. And I encourage you to use the exact same rigorous tools that exist, but flip them on their head for really trying to find reasons for success. And I'll tell you, it's hard. People are like, well, but there was like a 20-second, people want to not talk about success because we're attuned to not focus on what went well and why, right? And so it's hard, it is a brain shift. And so people were very willing to share facts of the case. And so we did a fishbone diagram, right? So I want to take a moment, right? You see things like this when it's like, ooh, root causes, what happened, right? Why did that not go well? In this case, it's, well, why did it go well? Well, there are things like, well, the bag valve mask is consistently located behind the gas machine. There's a direct line from the dental clinic to where a patient needed to go. Equity considerations. Translation services are indeed readily available, and they were utilized, right? An environmental thing. Wow, there was a break room that was adjacent to the sedation suite, and the escalation numbers, who to call when there's a problem, are prominently displayed. As far as methods are concerned, there are daily equipment checks, and there are biannual simulation drills for this specific emergency, right? All of a sudden, you're like, yeah, we do all those things. Right? We do most of those things, right? We do most of those things. So that's what led to success in this unit. But now the key answer is, are they hardwired into the other spaces and places, right? So once you've developed once you've developed success cause factors, right, like root cause factors, then it's important to really think about, well, hey team, what do you actually think of these factors led to success, right? And in this hypothetical case, folks said it was because the escalation numbers were readily available and because we had done simulation-based training. Okay, so that begs the next question, right? Have all of the other areas that are similar to this done simulation tracing? And the answer was no, right? The answer was no. So that identifies specific actions and ensure that these solutions are broadly applicable. So biannual interprofessional simulation drills were initiated. Any latent safety threats, oh, you know what, the BVM is not in the right place, or the medication was expired on that cart, are raised into the usual quality and safety machinery and addressed, right? Then it's a matter of really implementing this, right? Because there's so many good ideas that happen, but oftentimes there's a lot of momentum to want to do these corrective actions because it's not under duress, right? It's not under, oh my gosh, something scary happened. It's our colleagues did something great, right? And we want to honor that amazing work that was happening by doing this in our units. And so implementation, of simulation happened across multiple outpatient areas. And then just like anything, you treasure what you measure. And so measuring what happens. And so in this case, this fictitious, wink, wink, fictitious case, the percentage of individuals who participated in a simulation code was one of the key metrics, as well as the percentage of improvement opportunities that were addressed. Do you know how many signs with the escalation numbers had to be put up? Several, right? Several. Something that you think is so common, right? You walk by those same walls every day until you need it and you realize it's not there. And then employee recognition is a key part of this, right? I know Downstate, Health and Hospitals, Brooklyn Health, Maimonides, everyone has varying employee recognition and engagement programs. What a cool thing to be like, hey, I heard about that outcome. Great job, right? And not only great job, here's what we did to make sure it happens more often, right? That good outcome is likely to happen again. So in this case, clinical leadership recognized the teams and celebrated even just the fact that an SCA was done. And then again, those improvement activities over time were shared. Now, so what I described, this SCA of this fictitious case, was a standalone investigation. But I'll tell you, in talking to folks across really the globe now about this, people have said, I don't have time. And I want to honor that. And I want to honor that people may not have the ability to even do one a year. And I'm okay with that for now, right? But how can we take SCA-type principles and apply them then into existing activities? So y'all have to do root cause analyses, right? You have to do them. So we all remember this case, right? US Airways landing in the Hudson. So this is a screen grab of the report, right? So wow, what an amazing near miss, right? But by every measurement for the aviation industry, this was a very serious reportable event, right? Why did the engines fail? Why were et cetera, right? But what's interesting is that even in this report, the NTSB concludes that professionalism of the flight crew members and the excellent crisis resource management during the accident sequence contributed to their ability to maintain control of the airplane, configure it to the extent possible under the circumstances, and fly an approach that increases survivability of impact. Right? Even in an outcome that you would never wish upon anyone, right? Often the RCAs that we undergo at our institutions, like, pull at your heartstrings, right? Even within those cases, there are opportunities to think about what were some moves that were made that made this, something that was bad instead of really bad, right? And so there's an opportunity even within RCAs. And I'll tell you, it's very hard because people in healthcare, we are not attuned to really talk about when things go well and why they go well, right? It's often just a reframe, right? People want to go to, well, that wasn't available, this didn't happen, so-and-so and that, right? But oftentimes look for it because there will be really important things. It's just to imagine, right? If you infuse these success cause concepts into an RCA, it can reduce the perception of blame and increase active participation. We also have thought about, this is an example from my collaborator at Yale. There were two different units, two different areas, where two members were really kind of at an impasse. There were just sort of personnel disagreements that were happening. The other members avoided raising issues because they didn't want to upset people. And another unit had some of the same disagreements, but it seemed to go really, really well. Well, those people just must be nicer. That's not true, right? That's not true, right? We all come to work to do the right thing, right? But what it turned out was the functioning unit had discord, but they actually had shared agreements, not in crisis, that they developed not in crisis, where they had a plan for how they talk about disagreements and how they resolve them, right? So we can use SCA principles for all kinds of things and events that happen. So I really encourage you, the next time you're looking at an unfavorable outcome, I want you to really think about, well, there were probably 10 outcomes or 10 cases like this that went well. Let's learn from those as well. I also think about good catches a lot, right? We encourage good catch reporting, and sometimes we'll track 10 them, sometimes we'll learn from them, but I often really wonder, why did someone take the generosity of time and effort to report them, right? And so we've done sort of very micro success cause analyses in the sense of not a full sort of team and review to really understand, hey, tell me why you were so kind as to tell us that. And oftentimes they'll say, you know what? This happened to me before, I don't want it to happen again, right? Or I think we can be better and I have a solution for you, right? So there are many ways that you can incorporate the ideas or principles of success cause analysis into the work that you're doing every day. So, with that said, I know we're sort of spread out, but I'm going to encourage some audience involvement and participation. I want you to turn to your neighbor. Maybe it's someone you don't know, which would actually be really cool, really exciting, right? Maybe hi, right? Make a new friend. We're going to take a few minutes and turn to your neighbor, and I want you to introduce yourself if you don't know each other, but take 3 minutes to really think about what is one principle or one action that you might be able to take, no matter what level you're at, no matter where you're at in this organization, to incorporate success cause principles. And then I'm going to invite a few of you to share at the microphones. Okay? All right, 3 minutes. Let's go. Hello, everyone. 3 minutes goes by fast, right? And I appreciate some of you were talking about success costs. Some of you are catching up, which I'm here for, right? That success in and of itself. Sometimes the only times we see each other are places like this. And I appreciate people who are checking their phone. I'm here for it. Would anyone be willing to share a little nugget of their conversation? Please come up to the mic so other people can hear it. What's one way that you might think about manifesting success cause analysis principles into your environment? Come on in. Thanks so much. Please say who you are. Let's give it. Yes. The jacket's coming off. This is serious, everyone. Thanks so much.
Hi, how you doing?
Hi.
I'm Carlos, the Director of Emergency Preparedness here at SUNY Downstate. And I believe one concrete action we can take within our department to, applying success cause principles is highlighting our network here. For emergency preparedness, we're a very small team, basically me, Jennifer, and Dr. Daniel. However, emergency preparedness encompasses so many things, and if something happens at the hospital and if we need external help, we're able to get assistance within literally minutes, pick up a phone call. So networking is key to our success here, so much so that we participate in healthcare coalition meetings. Last week we got reached out to actually present on something we're doing here, which is implementing COOP, department-specific continuity of operations plans, which it's a very important and kind of dry topic across healthcare industries, but it's very important because this is a joint commission year and it's something that they're very much going to focus on. And that's something we want to share with the network and our colleagues here at Downstate. So, yes.
Thank you so much. Let's give it up for him. So, you said your name was Carlos, is that right? Carlos, thank you so much for sharing. There's so much wisdom in what he just said. How many times have you looked up an article and be like, this is a great article, only to realize it was published by someone you know, or is in your network, or is in Health and Hospitals, or is in New York, right? And so so beautifully you said share what you're doing. And I imagine in your presentation you'll share some lessons learned and sort of unpack what you did and how. And the fact that people will come to your rescue, right? You said that if I need help, people will come, right? What a beautiful and important feeling. So thank you for sharing that. Anyone else willing to share? Yes, please come on through. Yes.
Hi, good morning, everyone. I'm just going to talk about the success root analysis within our unit.
Yeah.
I'm from Labor and Delivery. That's my director right there, Miss Uva.
OBGYN, yeah,
Yes,
appreciate that.
yes.
Thank you for all you do.
It's just like an example, if we have like an emergency, say for example, we have like a serious postpartum hemorrhage or something.
Yeah.
After the situation has resolved, once the patient is stable, we do meet together during the huddle and we do acknowledge the things, not only the things that went wrong, but the things that also were done right. We do acknowledge the teamwork, because there's a lot of teamwork that has to take place within that situation. So we do acknowledge the teamwork during the debriefing, not only doctors, nurses, but whoever were involved in that case. So yeah, that is a little bit of success root analysis in labor and delivery.
I love that.
Thank you.
And what was your name?
Oh, my name is Rachel.
Thank you so much, Rachel. Appreciate it. So you're taking an existing sort of structure, right, a post-event debrief, and making sure that you're highlighting some of those things that went well, right? That has really interesting manifestations, not just for culture and for practice, right? Labor and deliveries have a lot of new people often, right? So they're learning, oh, that's how you do that. Well, it also has some interesting implications for documentation as well, right? As you're sort of talking about the moves that happened immediately after the case. So triple win on that, right? Thank you. Anyone else willing to share? Please.
My name is Adiola Dabiri from Regulatory Affairs. I was just speaking to Dr. Turner from pediatrics, and she told me that there was a time when a mother was in problem or in crisis in the pediatric clinic, and it was the registrar that actually noticed something that was going wrong with the patient, and so she got the attention of the nurse and the doctors, and they actually took care of the mother even though it was a pediatric clinic. What we talked about though is that she would go back and talk to this clerk or registrar and find out why she actually did and got the attention, what motivated her to act at that point.
Amazing. Thank you so much for sharing that. What a gift, right? What a gift to loop back and say, you know what you did mattered, right? And please tell me, let me learn from your wisdom. Get a little choked up thinking about that, right? Because we all have wisdom. Rami, I'm looking at time. I know what we're good on time. Do I have one more person, one more report out? I'm cool, we have time, I'm hanging. Yes, oh, amazing, we have two.
All right, I'll be quick so we can have
Please, both of you, come on, let's give them a hand. We'll go with you, and then we'll go with you.
Manisa from pharmacy. So we usually have a safe huddle every day. So we talk about, great catches, like example, and we also make it like manage up or shout out just to recognize somebody, who really, and we discuss about that, what else, like anybody want to share or manage up, their colleagues, and what we do pretty much have almost every day of the week.
Wow, that's amazing. Can I ask you a question? Thank you so much for sharing that. How long has that been going on?
I would say at least like a year and a half or 2 years.
And were you here before you started doing that?
Say it again,
Do you remember, were you here or remember how it was before?
No.
Okay.
But yeah, but
I'd be curious to hear a little bit from, if anyone from, when you start to institute that alone is a culture shift, but then what are you seeing, right? When people do share, what do you see? What happens?
So they're more engaged. They were talking about, they started to open up about the ideas and things like that. So they're kind of like shy, they want to speak up, but then we kind of like make it feel like they feel comfortable of saying things because it's not something towards them, it's just something to improve overall. So
Love
that's what
that.
we're trying to improve that.
Excellent, thank you for sharing. All right, our risk manager, final word, let's do this. Thank you so much.
Yeah, I feel obligated to be up there to, the risk management department is responsible for the information gathering, investigating events, and preparing a root cause analysis, to present to the team. And, we, like you mentioned, we do have the tools to do it correctly. And so I'm inspired today by your presentation to, do better at our root cause analyses. We have a wonderful team here, and we're all interested in patient safety. And, we're obsessed with safety. We have our quality huddle every morning, and we go through all our events, and it's a good thing. It's a healthy thing to do, and we're aware of the National Patient Safety Foundation methodology for doing that, and I think we're really close to doing it that way. So we're always looking to improve. So I'm really happy to have met you, and thank you for coming.
Awesome, thank you so much for sharing. Right? Our risk managers and others really, we gave a presentation for ECRI, which is the Patient Safety Authority for Pennsylvania. And one of the interesting things that they said was, when people see my face, they will often run and hide. Right? I'm sure you get that a lot, right? Uh-oh, right? And it takes a little bit of, when it's like you're coming and sometimes you have other things besides unfavorable things to talk about, right? It can add a lot of sort of benefit for the folks that are sort of in this every day, right? We're all in this every day, right? But every single adverse event crosses your desk, right? Sometimes it's challenging to think about anything else, right? So I appreciate that, and I'm glad to hear the comments resonated. So, listen, our work, there is so much to do. And we are all in this together, whether it's New York City, right? Whether it's the state, whether it's the country, and really beyond, right? We all have an imperative And I know we all feel it, right? That's why we're here, to improve quality and safety. And so we're in this together. Feel free to connect. My email's there. You know, like, tell me what didn't work about it. Tell me what worked. I'm happy to hear anything. So with that said, thank you so much for the opportunity to be with you today.
Dr. Bajaj, thank you so much for an inspiring talk. I love that how this came right after leadership in crisis. So being, you know, we always learn how to put out fire. We function really well in doing this, but we learn how not to be proactive, not to be reactive, to be proactive. But actually this talk is taking us above and beyond. Not just building just culture when we do our root cause analysis and not point finger and fix systems, but also go above and beyond and look at the root cause for why we did this well. And I think this is really a novel idea. And I love the idea of, you know, we don't have time, but let's put some time actually when we do our root cause analysis, just 10, 15 minutes to say the thing that went well and why they did well in this case. Even with the root cause analysis, even with the disaster cases, there are things went well. And I think we should focus on those as well. So why don't we start now, right now, with our board huddle? Why don't we have like 5 minutes every day in our board huddle to make sure that we point on the thing that went well, and not just point them out, but let's discuss why they went well. Let's start with this just now. We do our board huddle every day, right? So let's do it. Let's do the 5 minutes every day about why this went well. And let's learn from this and share it with the other team while we do our safety huddle, assisted safety huddle. Dr. Bajaj, thank you again. It was a great talk, and thank you for coming to Downstate. Our next agenda will be the poster session and the breakout rooms, and that will be in the Fab Hall in the Public Health School. So please visit. There are a lot of great work done, and we can learn from this. So thank you again for joining us, and we'll be back here at 1:30.